I'm very pleased that the subcommittee is continuing to work to help prevent suicides in the military. Since our last hearing, the Department of Defense and the services, with continued support from this committee and from the Congress, have worked hard to establish, to improve, and to enhance their suicide prevention programs with the goal, of course, of decreasing suicides in the military community. And I think we would all say not only just decreasing, but someday looking towards a time when it's very rare. Sadly, even with these increased efforts, this issue continues to be a difficult one to grasp, and the number of suicides continues to grow.
But I really want to address the issue of how you all are working together with each other and with the DoD. So on September 30th, 2015, the DoD Office of the Inspector General issued a report that states that, quote, DoD lacked a clearly defined governance structure and alignment of responsibilities for the Defense Suicide Prevention Program, unquote. And that report also states that the DoD, quote, did not standardize best practices across the department, and the services did not take advantages of each other's knowledge and experience, unquote. And I know that this is often not unique to suicide prevention. We hear that often in other contexts as well, that you work within your own service and not always across services. So I'd like first Dr. Franklin to address what changes are being made to address these issues, and also if each of you could comment upon how you share best practices and work across the services.
I couldn't be more pleased to tell you that the services meet on a quarterly basis. Their suicide prevention program managers, we've had 2 of those meetings so far. They're 2-day meetings. They share a number of best practices. I could give you examples, and you heard in some of their testimony where some of them are implementing similar tools like the Columbia Suicide Severity Scale or the VA safety planning. They learn that from each other, and those are exciting opportunities, and I absolutely see that as the future of the office.
To assess the risk, once we've identified some indication, we've introduced the evidence-based Columbia Suicide Severity Rating Scale across the entire Marine Corps to include our behavioral health providers, chaplains, legal assistants, financial counselors, and others.
We've also implemented several key evidence-based suicide prevention and intervention measures, including training on the use of the Columbia Suicide Severity Rating Scale and the Veterans Affairs Safety Plan to enhance risk assessment and intervention at the deck plate.